Dr. Alexander Kane and Vanessa Moore had hidden a secret for 10 years. An affair that no one suspected, not colleagues, not patients, not even the hospital itself, until a single heart surgery exposed everything, leaving reputations shattered and lives hanging by a thread. Dr. Alexander Kane had built his life around precision, control, and the kind of reputation most surgeons only dreamed of achieving. For over 2 decades, he had worked tirelessly in Los Angeles's top hospitals, performing heart surgeries that were considered nearly impossible by his peers. Patients trusted him with their lives, colleagues respected him for his skill, and administrators admired his efficiency. Yet beneath the veneer of professionalism, Alexander carried a secret, one that had been hidden for 10 years, carefully guarded and meticulously maintained. The affair began quietly, almost imperceptibly. Vanessa Moore, a patient liaison in the cardiology department, had impressed him from the start with her intelligence, efficiency, and ability to navigate the pressures of the hospital. Their professional relationship blossomed slowly, evolving into private meetings and late-night conversations. Over time, those meetings turned into something more intimate, something dangerous, and something they both swore would remain hidden. The affair was structured with precision, almost surgical in its secrecy, mirroring the way Alexander approached his work. Every interaction was calculated, every moment of contact carefully timed to avoid suspicion. Vanessa became more than a coworker. She became a confidant and a silent partner in a double life that neither could openly acknowledge. She managed patient communications, coordinated schedules, and ensured that Alexander's life outside the operating room remained orderly. For him, she was indispensable not only for her professional capabilities, but also for the emotional support she provided in the shadows. Together, they maintained the illusion of professionalism, hiding the complexity of their personal relationship behind carefully curated appearances. Despite the risk, the affair persisted for a decade. It was a delicate balance between desire and discipline, secrecy and exposure. Alexander knew that one mistake could destroy his career, yet he continued to meet Vanessa in private spaces, sending coded messages and carefully planning their interactions. The hospital remained oblivious, and colleagues noticed nothing unusual. Outsiders saw a highly skilled surgeon and an efficient liaison, unaware of the web of secrecy that connected them. But secrets, no matter how well protected, are inherently fragile. The pressure of maintaining a decade-long affair began to manifest subtly. Minor errors in scheduling, slight lapses in communication, and uncharacteristic distractions started to appear, almost imperceptibly, in Alexander's work. Nothing catastrophic, nothing immediately dangerous, but enough to indicate that the hidden personal life was beginning to intrude on professional duties. He found himself juggling his surgical responsibilities with the emotional strain of keeping the affair secret, and the tension became a constant companion. The strain intensified as Alexander prepared for one of the most complex surgeries of his career, a high-profile heart transplant for a wealthy patient whose case was being closely monitored by the hospital administration. The procedure would draw attention, not only from colleagues but also from the media and potential donors. For Alexander and Vanessa, the stakes were higher than ever. The meticulous secrecy that had protected them for 10 years now faced the ultimate test. Every glance, every message, every small mistake could unravel everything. In the days leading up to the surgery, the hospital was a whirlwind of preparation. Nurses reviewed protocols, anesthesiologists checked equipment, and staff moved with the practiced efficiency of a machine. Yet amidst the precision and order, the invisible tension between Alexander and Vanessa simmered, an undercurrent that no one else could detect. It was a quiet storm, building toward a moment when years of careful concealment would clash with the high-pressure reality of the operating room, threatening to expose a secret that had survived for a decade. The morning of the surgery arrived with an intensity that seemed to electrify the entire hospital. The heart transplant was a rare and highly complex procedure, drawing attention from administrators, medical boards, and even the media. Alexander moved through the operating room with precision, a surgeon accustomed to pressure, yet a subtle tension under his skin reminded him of the secret he carried. Vanessa, as always, was at his side, overseeing patient flow, verifying documentation, and coordinating the team. Her presence was both a comfort and a distraction, a constant reminder of the hidden life they had cultivated for 10 years. As the procedure began, the rhythm of the operating room was almost hypnotic. Monitors beeped steadily, instruments were passed with practiced precision, and the surgical team moved as a coordinated unit. Alexander's focus was intense, yet his thoughts occasionally drifted, a microsecond here and there, toward the messages that had appeared on Vanessa's phone earlier that morning. He told himself it was nothing, a minor distraction, but the weight of the secret and the consequences of exposure lingered in the edges of his mind. Small errors began to appear, almost imperceptible. An instrument was handed slightly late, a chart referenced incorrectly, a timing miscalculation that would normally have been impossible for a surgeon of Alexander's skill. Each was corrected immediately, preventing any harm to the patient, but the pattern was enough to catch the attention of the attending physician supervising the operation. To an outsider, these mistakes could have seemed trivial, but in a procedure of such magnitude, even minor deviations were cause for concern. Meanwhile, Vanessa received a series of urgent notifications. Someone had discovered fragments of their correspondence, small clues that hinted at a decade-long affair. Panic surged through her, threatening to disrupt the carefully constructed professional persona she had maintained for years. Every movement became slightly rigid, every glance slightly sharper. Alexander noticed her subtle tension but misread it as routine pre-surgical stress. Neither understood the full weight of what was unfolding until it was too late. The surgery progressed, but the undercurrent of anxiety between Alexander and Vanessa was palpable. The attending physician observed subtle signs of distraction and subtle deviations from standard procedure. It was clear that something external had infiltrated the operating room, yet the source was unknown. Every passing minute increased the risk that the hidden personal life, cultivated in secrecy for a decade, could interfere with the critical work at hand. By the time the surgery concluded successfully, the tension had not dissipated. The patient's condition stabilized, and the team breathed a collective sigh of relief. But for Alexander and Vanessa, the ordeal was only beginning. Investigators, hospital administrators, and legal experts would soon review records, messages, and operational details. The affair, hidden for 10 years, had left traces that could no longer be ignored. What had seemed like minor distractions during the procedure were now evidence that would unravel a secret life built on careful planning, trust, and deception. In the aftermath, the operating room stood silent, the life-saving work completed, but the personal consequences were already rippling outward. The high-profile surgery had achieved its medical goal, yet it had also created a situation where years of hidden intimacy, carefully maintained and fiercely protected, could no longer remain in the shadows. The cameras, the records, and the observant colleagues had all documented the invisible tension, leaving nothing truly hidden. The decade-long affair had survived countless moments, but this day had proven that even the most skilled, disciplined individuals could be exposed when personal secrets collided with professional responsibility. And the days following the surgery, the hidden threads of Alexander and Vanessa's decade-long affair began to unravel at an alarming pace. Hospital administrators, initially unaware of any misconduct, had begun reviewing procedural reports, staff communications, and patient logs. Small irregularities from the operating room had caught the attention of senior staff, and their curiosity quickly turned into a deeper investigation. Emails and messages were cross-referenced, and what had once been a carefully concealed relationship slowly became visible in digital records. Alexander had always believed that his reputation, skill, and authority would protect him. He assumed the hospital's hierarchy would prioritize his decades of service over any personal indiscretion. Vanessa, too, had trusted that their careful secrecy and meticulous planning would shield them from scrutiny. But over time, the evidence they had inadvertently left behind, meeting logs, time-stamped messages, and overlapping schedules, painted a clear picture of intimacy that had persisted for years. What had seemed minor at first now appeared as undeniable proof of a relationship that breached professional boundaries. The news spread quickly within the hospital walls. Colleagues who had once admired Alexander's precision and calm began to whisper about the situation. Nurses and administrative staff noted small, Unexplained favors, unusual scheduling patterns, and subtle deviations from protocol that now seemed to confirm suspicions. The hospital board, concerned about liability, summoned both Alexander and Vanessa for review. The investigation was formal, methodical, and relentless. Every decision they had made, every action they had taken, was scrutinized in the cold light of official inquiry. Outside the hospital, the story began to leak. Influential families, donors, and patients demanded answers. Social media and news outlets caught wind of the scandal, framing it as a case where personal desire had encroached on professional responsibility. Headlines questioned the ethics of one of Los Angeles's most renowned surgeons and hinted at the possibility of compromised patient safety. Alexander and Vanessa found themselves thrust into the public eye, their carefully constructed private lives exposed without warning. The investigation revealed that the affair had influenced minor administrative decisions, including scheduling and patient prioritization. While no surgeries had failed and no patient had been harmed, the implications were devastating. Ethics committees and legal advisors debated whether the relationship had created a risk that could have endangered patients, emphasizing the importance of perception and trust in medicine. Alexander's meticulous career was suddenly weighed against years of secrecy and hidden desires. Vanessa, once confident and composed, felt the weight of exposure crushing her. Her professional achievements were overshadowed by the revelation of personal involvement with a superior. The relationship that had once felt like a private sanctuary became a public liability. Each message, each meeting, each hidden gesture was now interpreted through the lens of risk and impropriety. As the investigation deepened, the 10-year affair ceased to be a personal story and became a cautionary tale. Hospital administrators documented the findings meticulously, medical boards reviewed every relevant detail, and colleagues whispered of a secret that had finally come to light. Alexander Kane, once untouchable in his field, now faced questions that could jeopardize his career. The decade of secrecy had survived countless challenges, but the exposure during and after the surgery proved that no secret, no matter how carefully guarded, could remain hidden forever. The revelation left both Alexander and Vanessa confronting consequences they had never fully imagined, marking the beginning of a public scrutiny that would redefine their lives and careers forever. The investigation into Alexander Kane and Vanessa Moore deepened as the hospital administration, legal experts, and ethics boards pieced together the full extent of the decade-long affair. What had initially appeared as minor distractions during surgery was now examined in exhaustive detail. Every email, text message, and calendar entry was scrutinized, revealing a pattern of secrecy that spanned 10 years. The meticulousness with which they had hidden their relationship now became evidence against them, showing how personal desire had intersected with professional responsibility. Auditors discovered subtle administrative irregularities. Patient appointments had occasionally been rescheduled to accommodate private meetings, and certain communications had bypassed standard procedures. While these actions had not caused harm, they raised serious ethical questions. The relationship had created conditions that, if pushed further, could have endangered patient safety. The hospital board emphasized that perception was as important as actual outcomes in medical ethics, and the case quickly became a textbook example of how personal indiscretions could ripple through an institution. Meanwhile, the hospital faced intense scrutiny from outside observers. Medical boards, regulatory agencies, and journalists began examining the story, highlighting the dangerous consequences of mixing personal and professional boundaries. Forums and articles debated the moral implications, questioning how a top-tier surgeon could maintain such a secret for so long without anyone noticing. Public interest soared, and the affair became a scandal not just for the hospital but for Los Angeles medicine as a whole. The professional world was watching, and Alexander and Vanessa were at the center of the storm. As the fallout continued, Alexander's reputation suffered irreparable damage. Colleagues who had once respected him questioned his judgment and ethics. Patients began to wonder if their care had ever been influenced by personal interests. Every accolade he had earned over decades now seemed overshadowed by a single exposure. Vanessa faced similar professional consequences. Her role as a patient liaison, once considered exemplary, was now viewed with suspicion, and her career trajectory was suddenly uncertain. The investigation also revealed the psychological toll on both of them. Alexander, known for his composure in high-stakes surgeries, showed signs of stress and distraction when performing routine procedures. Vanessa, who had once exuded confidence and control, became visibly anxious during board meetings and audits. The relationship that had provided emotional support and companionship had, under scrutiny, become a source of vulnerability. Every moment of intimacy and trust was reframed as evidence of ethical compromise. In response to the scandal, the hospital implemented sweeping reforms. Policies regarding personal relationships among staff were tightened, surveillance measures were expanded, and patient liaison programs were overhauled. Training sessions emphasized the importance of separating professional duties from personal interests, and staff were reminded that no career achievement could protect against ethical violations. The administration presented the affair as a cautionary tale, demonstrating that even the most respected professionals could be compromised by personal attachments. By the end of the investigation, Alexander and Vanessa's personal and professional lives were irrevocably changed. They retained their positions but under strict oversight, and their influence within the hospital was diminished. The affair, once a hidden sanctuary of trust and desire, became a public record of human fallibility and moral complexity. It was a stark reminder that in high-stakes professions like medicine, even the most hidden secrets can surface in moments where the consequences are enormous and unavoidable. The case left the hospital, the public, and the medical community with a lasting lesson. Skill and talent may earn respect, but ethics and transparency define true legacy. Alexander and Vanessa had survived the exposure, but the shadow of their secret would follow them forever. The aftermath of the scandal left Alexander Kane and Vanessa Moore in a world that felt both familiar and unrecognizable. Though they had survived the official investigation, their careers and reputations bore the permanent mark of exposure. Patients and colleagues who once admired Alexander's precision and calm now whispered about lapses in judgment, speculating about how personal entanglements might have influenced critical decisions. Vanessa, too, faced the judgment of her peers, and the professional respect she had earned over years of hard work was suddenly overshadowed by questions of ethics and loyalty. Alexander returned to the operating room under a cloud of scrutiny. Every move, every decision, every procedure was monitored more closely than before. The administration installed oversight measures, ensuring that nothing personal could influence professional duties again. While he continued to perform surgeries successfully, the invisible pressure weighed heavily on him. Each patient he treated carried the unspoken reminder that one mistake could erase the remnants of trust he had left. Vanessa, meanwhile, was reassigned to a more administrative role, her access to scheduling and patient care limited, a constant reminder of the boundaries they had once crossed. Public perception, however, proved far less forgiving than hospital policy. Media coverage had framed the story as a cautionary tale about obsession, secrecy, and the dangers of mixing personal and professional lives. News articles dissected every detail, and discussions on social media circulated both sympathy and scorn. The scandal became a reference point in discussions about medical ethics, and both Alexander and Vanessa found themselves scrutinized not only by the medical community but by the public at large. Their private lives were no longer private, and every past decision was reinterpreted through the lens of exposure. The emotional toll was profound. Years of secrecy, which had once given them a sense of thrill and intimacy, now felt like chains that had constrained their lives and careers. Alexander wrestled with guilt and regret, realizing that his decisions had created consequences far beyond what he had anticipated. Vanessa, who had once felt empowered in her dual role as confidant and professional partner, now confronted the vulnerability and humiliation of having their secret made public. Both experienced sleepless nights, lingering anxiety, and a sense of isolation that no amount of professional accomplishment could erase. Despite the scandal, the two survived professionally, though neither would ever fully regain their former status. Alexander continued to operate under strict supervision, and Vanessa's career was permanently altered, her role restricted and carefully monitored. The hospital implemented sweeping reforms, training programs, and stricter ethical oversight, using their case as a blueprint for avoiding similar incidents. The institution survived, But Alexander and Vanessa were left to navigate the consequences of choices that had once seemed personal and inconsequential. In the end, the decade-long affair became more than a story of personal indiscretion. It was a lesson in the fragility of trust, the consequences of secrecy, and the impossibility of separating private desire from professional responsibility. Alexander and Vanessa had learned that even the most carefully hidden secrets could surface at the most critical moments, forever altering lives and careers. The scandal remained a cautionary tale for the medical community. Skill and talent may save lives, but ethics and transparency define the legacy left behind. Their story ended not with a dramatic confrontation or criminal charges, but with the quiet, enduring consequences of choices made in secrecy, serving as a warning that even the smallest personal indiscretions can have monumental repercussions when exposed under the unforgiving light of truth.